Hey, it's Steve Grant here, and today I'm joined by Lara Rickard, who's a dietitian that specialises in polycystic ovarian syndrome, otherwise known as PCOS or PCOS by some people as well. In this video, this is the first of a series we're going to do on this video, but in this video what we're going to do is we're going to talk actually about the name PCOS and how it can sometimes be quite misleading in a sense, can't it? So do you want to take it from here?
Sure. So with polycystic ovarian syndrome, the fact that ovarian appears in the name places a lot of emphasis on the ovaries. When we look at what PCOS is, which we'll go into in further videos, but it's a condition of high androgens that impairs ovulation. And so what we need to do then is look where androgens, which are quote-unquote male hormones, are made. So they're made, yes, in the ovaries, but they're also made in the adrenal glands, and some testosterone can also be made in fat tissues. Okay,
so even though it's polycystic ovarian syndrome, actually there's other glands and tissue that are involved in the production of androgens as well.
Yeah,
okay,
absolutely.
Perfect.
So, yeah. And then the other reason for the name being somewhat misleading is the fact that polycystic ovarian syndrome, which implies that they're cysts. And for a lot of women I speak to and come across, they get quite fearful by this because they associate that with tumours or cancer or quite frightening conditions, when actually they're not cysts at all, they're follicles.
Yeah.
So our follicles are the eggs that are in the ovaries, and every month we'll have anywhere from 6 to 12 follicles, so eggs that could be released, with the one being released at ovulation. And when that one is released, the others are reabsorbed into the ovaries. But with PCOS or PCOS, because ovulation can be impaired, it then doesn't happen, so there's not that release and then there's not that reabsorption. So these follicles have essentially become stuck, and that's what appears on ultrasound.
Okay, great. So there's a couple of sides where it's a bit misleading. One is the actual, like the glands where it's being produced, that produce androgens, which seems to be, we'll talk about this in later videos, but which seems to be the main driver.
Yeah.
And then also this kind of cystic side of it where actually that's kind of a little bit misleading and also can create a lot of, in a sense, fear and turmoil for some people as well. Great. So in future videos we're going to kind of go further into the androgen side of it as well, and what else might be contributing to PCOS, plus a bunch more information about what we can do about polycystic ovarian syndrome as well. Thanks a lot.